Okay, Chapter 43 is basic emergency care. In this particular chapter, not only do you need to look over the key terms and key abbreviations, but you need to look at box 43.1, which is rules of emergency care. Okay, you need to look over that. I know I probably will say some of it throughout the presentation, but you do need to know it, okay, because I'm sure that I will have a question pertaining to uh, rules of emergency care. Okay, so first aid is the emergency care given to an ill or injured person before medical help arrives. The goal is basically here to prevent death and prevent injuries from becoming worse. In an emergency, the EMS or the emergency medical service system is activated. So to activate the EMS or the emergency medical services, you have to call 911. Or you may have to call the local fire and police department or call the phone operator. In nursing centers, a nurse decides when to activate the EMS system. Um, this usually does not fall to your responsibility, but there could always be some form of catastrophe where you might have to actually do this. But most of the time, it's not that bad. So the nurse is responsible for this. So know your center's policy about CPR. The nurse will tell you how to help if the person has stopped breathing or is in sudden cardiac arrest. The nurse may start CPR or may have you help in performing CPR if you are CPR or if you are BLS certified. BLS, which means basic life support, procedures are used to support breathing and circulation, and the American Heart Association BLS course teach the adult chain of survival. The chain of survival actions include early access to emergency cardiovascular care, and this includes activating the EMS system, as well as early CPR, early defibrillation, and early advanced care. Cardiac arrest. When a person has cardiac arrest, known as sudden cardiac arrest, the heart and your breathing stop suddenly and without warning. There are three major signs of sudden cardiac arrest. There's no response, no breathing, no pulse. In a respiratory arrest, that just means the breathing has stopped for some reason. Okay. Now, if the breathing is not restored, then the heart will stop. Okay. And cardiac arrest will occur. So just remember this, in a cardiac arrest, no breathing, no heart. In a respiratory arrest, no breathing, but you can still have heart, at least for a little bit. CPR, this is when the heart and breathing stop, the person is considered clinically dead. So CPR has to be started at once. It's in sudden cardiac arrest. And the CABDs of CPR are chest compressions first, airway, breathing, and defibrillation. The chest compressions and airway breathing procedures are done until the defibrillator arrives. I'll go back to the recovery position. Now, I told you before, we're not deeply into CPR because if you go into nursing, you're going to get into CPR. And if you go to a facility, you need to have CPR training if that's what the facility wants. But anytime that we have a person who's injured or has some form of emergency, we can put them into what is called the recovery position when the person is breathing and has a pulse, but maybe they're not responding. And the position just helps keep the airway open, prevents aspiration. So you want to log roll and remember, log roll is moving the person as one unit into the recovery position. You want to keep the head, the neck, and the spine are all straight, and a hand supports the head. So you're basically going to put them into a sideline position, but you want to do it do it as a log roll position. Don't use this position if you think the person might have neck injuries or other trauma, because remember, again, you're going to take you have to have a support there for the neck. Did I get out there? I'm sorry. Okay, hemorrhage. Hemorrhage is the next form of emergency you can come across, and a lot of it bleeding. If they fall, they hurt themselves, they're going to be bleeding. And hemorrhage basically is just an excessive loss of blood in a short time. Now, if it's bleeding that's not stopped, the person will die because they're going to basically bleed out. Okay. And you can have an internal hemorrhage or you can have an external hemorrhage or external bleeding. Internal bleeding you can't see because it's inside the body or a body cavity. So you can't see it, but we can see fluctuations in the vital signs. Okay. In external bleeding, it's not hidden. If it's not hidden by clothing, that's usually the easiest to see. Like you see the person, I was telling you about the person who fell. When she fell, she hit the corner of the bedside table, made a big gash in her head, and hit her glasses and all that good stuff. So, bleeding was, again, very visible. Again, if it's from an artery, it spurts at you, okay? But if it's just a steady flow, then it's from a vein. Well, what you do for a hemorrhage, um, I'll go back. When you have a hemorrhage, then the first thing here you want to do is to stop the bleeding. So you might need to put pressure on the area that's bleeding, to put pressure on it. So you want to get those gloves out as soon as possible. Now, sometimes what happens here is we get in there and we don't have any gloves on, and you actually touch your hand to the person's um, area to stop the bleeding. Depend arteries would be worse, that's spurting blood compared to like a vein. So if I had to put my hand on something that was bleeding until someone else could come and help me, you to put pressure on there, as soon as you're done, you need to wash your hands ASAP and get all that blood off of you and wash, and more wash to protect yourself. Okay. Let's see. Okay. So another thing on hemorrhage, you can go to your book. You want to keep the person warm and flat and quiet until help arrives. Don't give them any fluids because if it's internal, you don't know where it's bleeding, and you could cause actually more injury. So you don't give the fluids. Um, if you see the bleeding, you want to put pressure on the affected part that is bleeding. You can also, if it's like on an extremity, you can elevate that extremity, make gravity work for you. It's harder for blood to go uphill than downhill. So if you can raise that arm or that leg, that will help too. You can put a dressing over the wound if you have one there, or you can, if use a clean towel, a handkerchief, anything that can help provide um, pressure with not just your hand. But if you have to, you can actually apply your hand directly over the bleeding site. Um, we can also, sometimes we have to bind a wound until the bleeding stops. And usually by that time you've got extra help there. They can help you out with that, but we would bind it up, and that would be an emergency. So they're going to go out to the emergency room. Now, fainting is just a sudden loss of consciousness from an inadequate blood supply to the brain. And usually when a person is getting ready to faint, they look pale, weak pulse, and their respirations can be shallow. It means the depth is very shallow if consciousness especially is lost. And lots of things can cause fainting. Hunger, fatigue, fear, pain are all common causes of fainting. Standing in one position for a long time and being in a warm, crowded room are other causes. So, I mean, fainting has lots of causes. If the person feel faint, have them sit down, okay? Have them sit or lie down before fainting occurs, so that, because if they faint, they're going to give way. What's going to happen? They're going to fall. They're going to fall and hit something. So if you can catch them when they feel faint, have them sit down or lie down before that occurs. If they're sitting, they can bend forward and put their head between their knees. Okay. And then if they've got tight clothing, loosen it up. Keep them lying down if they have fainted, and raise their legs. Everything, when they do faint, we want everything go towards the trunk and towards the head. So that's why we raise the legs. Um, if you don't want the person to stand up for at least about 5 minutes until those symptoms have subsided, okay, before they try to stand or sit or stand up again, especially if they've been fainting or they have a history of fainting too. And then help them. You don't leave them. You help them to a sitting position after recovery if they have fainted. And then again, you continue to look for those symptoms and signs to reappear if they're going to faint again. Now, shock occurs when the organs and tissues do not get enough blood, and that the causes can be from hemorrhage or blood loss, heart attack, which is another name for that is called a myocardial infarction, and sometimes you hear it shortened up as MI, burns, and severe infection. So signs and symptoms can vary, but can include a low and falling blood pressure, a rapid and weak pulse, rapid respirations, cold, moist, pale skin. They're thirsty. They can get really restlessness. They get a lot of restlessness and confusion and loss of consciousness as the shock worsens. Now, there's a special kind of shock we're going to go over, and it's called anaphylaxis, anaphylactic shock. And this is when people are highly allergic or sensitive to either some form of food like a peanut, insects like bees or wasps, ants, chemicals or and medications. And what happens here is the antigen is a substance that the body reacts to. So it's the venom of the insect that the body is reacting to. That's the antigen. Or the whatever's in the peanut oil, that becomes the antigen because that's the substance the body is reacting to. But what happens is we have this over sensitive inflammatory response that happens, and anaphylaxis is life threatening because the body is just so overreacts to this that that they start to swell up, and they break out in hives, and they basically, because of the swelling, that inflammation process that goes on when it happens, this is what they can't breathe, and then it's an emergency, and the EMS system has to be activated. And this is usually when we get out the EpiPens if they have them. Um, and that's the special medication they're talking about. One of the special medications they're talking about to reverse the allergic reaction. Sometimes you can have a milder reaction, and they might give you they'll give you Benadryl. Benadryl helps reduce inflammation too. So you will see that given as well. But that EpiPen, that's the medication they use for the severe allergic reactions. And when that happens, it's called anaphylactic shock. Now, let's see. How about let me go back over the anaphylaxis in your book. It has a nice little list of symptoms that occur, like they start to sweat, short of breath, they have their blood pressure can be low. They have an irregular pulse, respiratory congestion, the swelling of the larynx, and it's called laryngeal edema. Hoarseness, dyspnea means difficulty breathing. All those symptoms can occur, and of course that's part of anaphylaxis. And we're going to be hurrying up to get you that EpiPen. Then stroke. Occurs when the brain suddenly is deprived of its blood supply, and that can be caused by a thrombus, which means um, a thrombus is like a blood clot, or an embolus, and this is where a blood clot has traveled, or a hemorrhage of a blood vessel in the brain ruptures. So you actually have a bleeding in the brain. So signs of stroke really depend on the size of the stroke and the location of the brain injury. So basically, you want to follow the word fast, facial drooping, um, fast. F is for facial drooping. A is for, oh, daggone it. It'll come to me here in just a second. S is for slurred speech, um, awkward speech, slurred speech. What in the heck is for? Oh, loss of their motion of their arms or any type of extremity, facial drooping, and then T is for time to call 911. I'll make sure I give you sure because it's a really neat thing. The American Heart Association recommends you use FAST for a stroke victim. So if you're unsure and these symptoms are occurring, you know that a stroke can be happening and it's time to call 911. But what signs and symptoms you'll have really again depends on the location of the brain injury. Oh, I forgot to tell you. If you do think someone is having a stroke, not only do you want to position them in the recovery position on the affected side. So if they're like they have a left-sided weakness, then you want to put them on the left side, okay, in the recovery position. Um, and raise the head without flexing the neck, and loosen tight clothing, and keep them quiet and warm. And of course, activate your EMS system and provide CPR if that's necessary. Now let's go on to seizures. Seizures is another thing you might see in the facilities. And seizures, otherwise known as convulsions, are usually these violent and sudden contractions and tremors of muscle groups. Not always. It depends on what type of seizure it is, but seizures are caused by an abnormality in the brain. A single seizure does not mean they have epilepsy. Seizures can be caused by different things. Epilepsy is just one thing that can cause a seizure because epilepsy is a brain disorder in which there's clusters of nerve cells don't signal that don't signal normally. They signal off abnormally. And so there's brief changes in the brain's electrical function. And in epilepsy, seizures recur. They'll come back again. And there's no cure for epilepsy at this time. So they usually take medications that control the seizures. Okay. Um, but there are other things that can cause seizures. A high temperature, excessively high temperature can cause a seizure. They could have a head injury that can cause a seizure. Um, brain tumors can cause seizures. So it's not just epilepsy when you have a seizure, and they can have what's called a partial seizure or a generalized tonic-clonic seizure, and most people call those grand mal seizures. So there's different types of seizures. So if you see a person in a seizure, number one, you can't stop it. So don't try to stop it. What we do try to do is protect the person from injury. So if they're moving their head around, then we're not going to let them beat it up against the concrete floor if that's where they've gotten to, or against the side rail or whatever. So we want to protect them, but you can't stop a seizure. It will stop on its own, hopefully. Um, but you don't leave the person alone. If lower them to the floor if this happens to be in a chair, just basically to keep them from falling. You do need to note the first one you ever see, if you ever get to see one, is pretty scary, but you really need to note the time that it starts as well as the time that it stops. And of course, loosen up any tight clothing they can have. Don't put any objects or your fingers between the person's teeth. You might have heard that in the past or seen it in the past. Don't do that because they can bite down and hurt you. Or they can break their teeth on an object. So if the only time we do put the padded tongue blades up or the bite sticks, but really the only time you could actually ever use that is if they have the R and they know it's coming before they have the seizure. You can put it in, but after they've had the seizure, you can't do anything. So don't put your fingers in their mouth or try to keep their this an old thing that they could swallow their tongue or that they'll bite their tongue. They can bite their tongue, but there's nothing you can do about it. Okay, it's just something we'll deal with afterwards. Um, and of course, if we have to, we'll provide BLS if the person's not breathing after the seizure. Now, the next emergency, I've already talked about that. Okay, burns. Burns can severely disable a person and they can cause death. Most burns occur in the home. Infants, children, and older people are high ones are at risk. And burns are described as either superficial, partial thickness, or full thickness burns. The superficial involves just the epidermis only. Okay, so the skin could just be reddened. A partial thickness involves the epidermis and part of the dermis. So this is where you get the blistering. And then the full thickness involves the entire epidermis and the dermis, and then nerve endings are can go all the way down to the bone in full thickness burns. And of course, your book has some horrendous looking burns for you to look at. It shows you an electrical burn, and they can be pretty yucky to look at. But again, they need because remember your skin is your largest organ. It helps protect you from not only infection, but it also helps regulate temperature as well as our body and body water, our water loss. So if we don't have that, all that gets screwed up basically. Okay, so with the burn, it can be really quite life threatening, even with simple, you know, you don't think a lot about just being little simple burns. So burns are really simple and they're painful. And the severity of the burn really depends on the burn size and the depth and the body part involved and the person's age. So don't touch the person if you think they're still in, if it's an electrical, if you suspect it's an electrical burn, then, or they're not moving and there's an electrical source lying across them, you make sure the electrical source is turned off or you're going to become a victim too. Number one, because electrical burns are common are one of those common that can occur. Now, in older folks, guys, the most common burn is hot liquids. Okay, it's that hot coffee they spilt in their lap or whatever it happens to be. Um, so don't touch them if they're in contact with an electrical source. Sorry, my train got off track. But have the source turned off and then use an object that does not conduct electricity to remove the electrical source if you can't get the electrical source turned off. Okay. And then if the person does have a burn and their clothing is involved, make sure um, you don't remove the clothing, the burn clothing. You leave it on because you can actually cause more injury. Loosen any tight clothing, and then um, if they are, we want to stop the burning process in a burn. So that's why you put their, if they burn their hand, say they burnt their hand with their coffee, you put it in cool water as soon as possible to stop the burn, because that's the main thing is to remove the person from the fire or the burn source and then stop the burning process. Um, Whatever that happens to be, whether you had to put out flames with water or roll them on the ground or smother the flames or whatever. Um, so you do what the nurse will hopefully do, or you may have to help with, is cover the burns with sterile, cool, moist coverings because that again stops the burn and also protects the exposed skin until more advanced support can be given. And you never put oil, butter, salve, or any ointments on burns. Okay. And then cover them with a blanket or coat to prevent heat loss. Because remember, they've just now screwed up their body heat regulation when they have a burn. So basically, quality of life here is protect the person during emergencies, um, protect their right to privacy and confidentiality, protect them from onlookers because, you know, catastrophic events, no matter how light the catastrophe is or how bad it is, people want to see. So protect the person protect their right to personal choice and so forth. And you can read the rest of that. But remember that they do have a choice in hospitals, so you need to ask them or have that information on hand of what hospital they want to go to if you have several in the area. And remember, the person can always choose to refuse care. So this ends chapter 43 on basic emergency care, and I will see you all in class soon.